Hi, folks. It's John Goodman again. I'm self-isolating here in my condo. I hope you're also being careful and safe wherever you are. We have with us today Dr. James Pinckney, and he practices what is called direct primary care, what I used to call concierge medicine. And it is a new way to provide medical care to patients, and it is coming online very fast. Dr. Pinckney, thank you for being with us.
Absolutely. Thanks for having me on, John.
Can you just tell us briefly how you typically relate to your patients?
Yeah, so with direct primary care, our clients have direct access to their physician. We offer 24/7 access, so they can call my cell phone anytime, day or night, and I pick up personally. We offer unlimited visits. There's never a copay in our office, as well as unlimited urgent care. So we communicate via telemedicine. We have our own HIPAA secure app called DrLink. Patients can come into our office and have a routine visit in the traditional manner, or we can video chat. So it's a great way to reinvigorate the patient-physician relationship and deliver the care and the quality of care that patients deserve.
But if I had a bad stomach ache, I could call you in the middle of the Dallas Cowboy football game or the Mavericks basketball game. Or
absolutely. I've done it third quarter, Sunday night, someone fell and cut themselves. I went up to the office, stitched them up, and I was back for the fourth quarter of the Cowboys.
How long have you been doing this?
I've been doing DPC for 8 years. I started Diamond Physicians in 2012 here in Dallas. We have multiple locations, and now we have a national network called Diamond Direct Care, where we've got 30 or so facilities across the country that we use to take care of employer contracts that have employees that are spread out all over the country.
Is that the main way you get patients, is through an employer health benefits plan?
No, right now there's a lot of barriers with the employer solution. Right now, HSA accounts cannot be utilized. If you have a HSA eligible plan, it cannot be paired with DPC. So right now, I'd say about 85 to 90% of our clients are individuals and 10% are businesses. I'd love to see that ratio closer to 50-50. I think this is a great offering for employers. It lowers healthcare spend by about 20 to 25%. We reduce the incidence of chronic disease by 70% and hospitalizations by 70%. The reason why most people go to the ER is because they can't get in to see their doctor. Since we're available same day, we take care of those issues, and we also take care of them in a much faster, more efficient manner. So if someone has, let's say they have a small infection on their leg, a cellulitis is what we call it, they would call us same day instead of waiting 7 to 10 days or even 3 weeks to go see their doctor. By that time, that cellulitis can turn into a very serious infection, especially in a diabetic patient, and maybe it turns into a systemic infection called sepsis. And that's where we really get into reducing hospitalizations by addressing the needs of our patients immediately, instead of the national average of seeing a doctor face-to-face is somewhere in between 35 and 46 days.
Now, I have discovered that the American Medical Association and the Texas State Medical Association and many other state medical associations are not fond of what you do. Why is that?
Well, I don't know. It doesn't make sense to me. Direct primary care is better for patients. It's better for doctors. Diamond Physicians, we pay our physicians about 40% more than the national average that a primary care doctor receives. The doctors have more time with their patients, more time with their families, a higher quality of life. Right now, physician burnout and depression is at an all-time high. About 65% of doctors report burnout and say that they wouldn't go into medicine if they had the choice again. And we also help lower the overall cost of healthcare for the system. So we don't just bend the healthcare curve, we break it. We spend about $3.3 trillion on healthcare annually, and a third of it is waste. And DPC only contributes to solving the problem. So I don't know why people don't like DPC and why some governing bodies don't think it's a good idea. We've done nothing but prove over the last decade that the healthcare delivery model that DPC offers is better for patients, doctors, and the system.
And the patients that use your services, are they happy with them?
We have less than a 2% attrition rate. So yeah, they love our service. I've had clients literally that have been with me from day one, 8 years ago when we opened. And the reason why people quit is if they move or if they just can't afford us. And in the COVID-19 pandemic, that's understandable. You know, we've had a couple of clients say, you know, I love the service, but Dr. James, I lost my job. I have no income coming in. I have to pause my membership. And we've been able to offer them the ability to pause their membership because of COVID-19, and they will come back to us once they have the finances because it's such a wonderful service.
Now, am I correct that under a normal relationship, you would get from a patient a certain number of dollars per month, and then there's no extra charge when they talk to you by phone or email or Skype or Zoom? Is that right?
Right. There's no additional cost for any interaction with your doctor, any prescription management, and anything that we can do within our four walls. So if our clients, and I like the word client instead of patient just because of that customer service relationship that we inject into our model. If our clients need a laceration repair, which is stitches, it's included. If our clients get a stomach bug, like you mentioned, and have abdominal pain and need to come in the office for IV fluids and nausea medication, it's included. If you tweak your knee and you need a steroid injection into the joint, it's included. We include basic labs, a CBC, which is a blood count, CMP, which is an electrolyte count, A1C for diabetes, a lipid panel, which checks your cholesterol, as well as a TSH for thyroid, as well as pap smears for women in the annual or monthly membership. So the value is tremendous. Then we go out and negotiate cash pay discounts for labs and imaging. So if you do need to pay for extra labs, like if you're diabetic and you need quarterly insulin levels as well as an A1C, A1C is $5. So the cash pricing is tremendous. Imaging is even better. $60 for X-rays instead of $500. CT scans are $250 instead of $2,000, and MRIs are $350 instead of $3,000. So you can see how we can save individuals and companies a tremendous amount of money with the cash pay discounts that we offer. In the insurance model, you have no idea what the end bill is going to be. Your doctor just writes you a lab slip, you go get your labs, or you go to your imaging facility, and you have no idea what the cost is going to be. And sometimes when you have a $5,000 or higher deductible, and if you've hit your deductible, most insurance patients have a 10 or 20% copay. So a lot of times our cash pay prices, John, are less than the patient's copay. And our job, I feel like we have a fiduciary responsibility to make sure that our clients are getting the most value from their membership. So we ensure and walk them through the process. If they need any services outside of our office, we make sure they're getting it at the best price and at the best facilities.
If I need a generic drug, let's say, and I go through you, how much cheaper would it be than if I just walked in off the street with a prescription from some other doctor?
Yeah, typically about 70 to 80% discounts on generics is what we're seeing.
Really?
Yes, sir.
What if I need a specialist? Do you have relationships with specialist physicians?
We do. So we have our Diamond Direct Care network of specialists. The specialists, we have 3 in every specialty. So cardiology, nephrology, which is kidneys, pulmonology for the lungs, rheumatology. They will see our clients within 48 to 72 hours instead of 3 to 6 weeks in the typical insurance specialist referral networks. So we get our clients in fast with great doctors, and it's another great asset to Diamond Physicians.
Now, are you ever having to deal with Blue Cross or Aetna or Cigna or any of the traditional health insurance companies, or are they just no part of your business?
So we don't accept any type of insurance. However, the BUCAs are starting to catch wind of DPC, and we are working with some of them.
Tell people what a BUPA is.
Blue Cross, United, Cigna, Aetna, Humana, those are the BUCAs. Okay. And
the bureaucracies.
We are working with some of the BUCAs on different projects that will allow us to integrate DPC into some of their offerings. So it's exciting
DPC
times.
is what you do, direct primary care.
That's right.
Okay, all right. Does a typical patient of yours, I guess if they're going to deal with you by Zoom like we're talking now, they have to have a laptop and they have to know how to get onto Zoom. Do they typically have any other monitoring devices that they can operate from their home, or do you encourage them to do that?
Yeah, so we have there's a lot of technology right now. There's pieces that clip onto your cell phone. There's an otoscope that you can look in someone's ears with. There's a stethoscope that you can click on. And I can actually listen to someone's heart and lungs. So there's all kinds of fantastic technology that's out there right now that can help bridge this kind of telemedicine divide that you have when you have to physically examine someone. And we don't give these tools out to everyone, but specific clients of ours do have these tools. For instance, if I have a mom or a dad that has children that have frequent ear infections, we'll go ahead and get them that otoscope that clicks onto the back of their cell phone. And then they don't have to come in every time one of their children has an earache. They can just look in the ear, take a picture, send it to me, and I can actually see what's going on. So I'm not just prescribing antibiotics for no reason if there isn't an actual ear infection.
Couldn't direct primary care, wouldn't that be a boon to Medicare patients?
Medicare, Medicaid, any government-sponsored plan, any plan would benefit from DPC. I think the issue is that we need to be compensated from the patient. So if Medicare could give the patients a card, maybe something like an HSA card, and they would be responsible for utilizing those funds with their doctor, you'd actually have a lot better adoption. You would have a lot better utilization of resources, and the doctors would be happy because it would be just like receiving an HSA card or a credit card for us. I think when you get back into government systems paying doctors and being in the middle, a lot of DPC doctors are not going to go for that. But there is a way to set it up to where all the parties benefit, including, most importantly, the patients.
Right. Dr. Pinckney, thank you for being with us here today. Thank you for giving us your time, and we appreciate everything you're doing, everything you have to say.
Oh, well, thank you so much. I enjoyed speaking with you, John. I'm a big fan of you guys and all that you do for healthcare policy. So keep up the good work, and whenever you need me, I'm here.
Thanks so much for spending time with me this morning. I think you know we're a nonprofit organization. We depend on voluntary contributions from people like yourself, and that's the only way we can sustain the work we're doing. If you like what we're doing, you want us to continue doing it, then we do need your help. And on the page below this video, there's an opportunity for you to give to us. And if you have a few extra shekels in your pocket, now's the time we could use the help.